I'm the Vice President of Quality and Interprofessional Practice at Saskatoon Health Region. Saskatoon Health Region is the largest health region in Saskatchewan, and I provide leadership around professional practice, quality, and safety, and I lead the strategic work on client-family-centered care for the organization. I think the three main challenges around patient experience is actually ensuring that we're looking at the continuum. So traditionally it's very easy to get very focused on the acute care side and the silos. So, really starting to look at the whole journey of care for a patient, family, resident, client, along the continuum, as opposed to looking at their care as episodic care. And I think traditionally most of a patient's and family's care is provided outside of acute care facilities, yet a lot of our time is spent on those acute care facilities. So how do we look at what does client-family centered care mean outside of the walls of there, and also help with those transitions and those transition points there. I think the other challenges is we've been a very provider-driven system, and so our challenges is to continue to make sure we bring patients and families or residents, if it's in long-term care, or clients in home care, to the table, and to have them be part of decision making at every level of the organization. And we're seeing that happen, and we're seeing amazing results from that. But we're challenging the status quo around that, and it requires us to really push our preconceived assumptions. That's always continued work to do. So I actually think we're in a really good place, and actually the conference has been great in kind of reiterating to me that we're on the right place with some best practices, and yet there's lots of pearls for me to take back. And so right now we have over 140 client family advisors, resident advisors, and we have 14 councils that are working. So there are councils that are they have patients and families and clinicians together on the councils, and they're very much working councils. So they don't just sit and talk, they're actually doing actual projects and work. And we have them everywhere from ICU council to home care we've just started, and we've just started an Aboriginal Peoples Council, because as you heard in the conference, sometimes the way we structure things does not meet our immigrant or our diversity of our population, and they have a harder time maybe the way we structure it, having a voice. So we've intentionally created an Aboriginal Peoples Council, and we're seeing some great, exciting work coming out of that group as well.
That's great. And just lastly, what are you hoping to get out of the conference, and what have you gotten out of it so far?
So, the one great thing about a conference like this is just the connections with other people doing great work. So it both is validating in some ways when you're hearing people talk to say, oh, we're doing that, and that is a best practice, and we're doing well in that. And also to say, oh, they're really doing something different, and how can I take that back and see how it can enhance what we're doing. So connecting with other people so that I know I got contacts afterwards to call up and learn more from, validating what we're already doing and the best of, and then really seeing other possibilities that I can take back and engage with my team around.